Hello, my name is Sarah with the West Virginia University Department of Forensic and Investigative Science, and I'm here to tell you about my project, the rapid electrochemical sensing of acetaminophen using screen-printed carbon electrodes in forensic and environmental applications. The analyte focused on is a well-known drug called acetaminophen. As a drug, it's also called paracetamol, and the chemical name is N-acetyl-P-aminophenol. Whatever you call it, it is very well known because it's such a common active ingredient, from the brand name drug Tylenol to combination medicines such as allergy and cold medicines. At normal doses, it is effective as a pain reliever and to lower fever. However, it can also harm the liver if too much is taken. Because it's so common, acetaminophen shows up and we need to be able to detect it in a wide variety of contexts. Some of these are fairly straightforward. So for example, since it's in all these pharmaceutical products, we need to be able to measure it there in order for quality control purposes. And then similarly, since patients are taking the drug, doctors need to be able to monitor it in their system to check, is it there, how much is there, and is it too much? However, acetaminophen also shows up in some surprising places. The first of these is in the world of seized drugs. When people sell illegal drugs, that process is not at all regulated, so they often include cutting agents in order to increase their profit margins. And acetaminophen is a common cutting agent. So analysts that are looking at these suspected powders need to be able to detect compounds including acetaminophen. And then additionally, because so much acetaminophen is produced, taken, and then excreted all the time, it can end up in the environment and in particular in wastewater. And therefore, the goal of this work was to develop a fast and inexpensive electrochemical method to serve as an effective screening test for acetaminophen. What is an electrochemical technique? An electrochemical technique involves an electrochemical reaction, which is simply a chemical reaction where electrons are transferred. We say that the compound that lost electrons was oxidized and the one that gained electrons was reduced, so we can also call these redox reactions. In particular, we use voltammetric techniques, which means the instrument applied changing potential to drive these electrochemical reactions and then measured the moving electrons as current. Electrochemical techniques are ideal for screening methods due to multiple advantages. They tend to be faster and less expensive than traditional analytical techniques. They can still be sensitive and selective, and they can be applied in the field, so where the patient is or where we found the suspicious powder or where we took a water sample. Finally, we use screen-printed carbon electrodes for this work because they are small, which makes them portable and allows them to work well with small samples. They are also disposable and especially low cost. The first step was to check that it does undergo these electrochemical reactions. We use cyclic voltammetry, so we both increased and then decreased the potential in one run to look for both oxidation and reduction. We also started with a high concentration of acetaminophen at 50 parts per million, and we started with pH 9.5 Tris-HCl buffer. We saw that it was electroactive and had both an oxidation peak at 0.29 volts and a reduction peak at 0.027 volts. Previously, one mechanism that has been proposed for what happens in this oxidation and reduction is that acetaminophen is oxidized to NAPK and then can be reduced back. And one reason this is interesting is that this parallels one of the processes that happens in the body. There are enzymes in the body, such as cytochrome P450, that can oxidize acetaminophen into NAPK. And another reason this is important is that NAPK is reactive and can go on to other reactions. The next step was to determine what the best pH for analysis was. We looked at a wide variety of pHs for the Tris buffer, and we saw that similar pHs performed close to each other. We did select 9.5 as the optimal pH, and this is also close to the pKa of acetaminophen, which is 9.38. Next, we needed to develop the actual method. We use square wave voltammetry for this because square wave voltammetry tends to be highly sensitive and very fast. We looked at blank buffer, which had no acetaminophen added in a range of concentrations. Due to instrumental limitations, we did run one scan to increase the potential and look for the oxidation peak, and then a second scan in the opposite direction to see the reduction peak. This was successful, and we did see both the oxidation and the reduction peak increasing with increasing concentration whenever acetaminophen was present, whereas we did not see any peaks in the blank. However, we did note that the potential of the reduction peak did shift compared to with the cyclic voltammetry. Both the size of the oxidation peak and the size of the reduction peak were related to the concentration, and the linear range was from 1 part per million to 10 parts per million. Next, we wanted to test it out with some simulated samples. We started by simulated samples in tap water. To do this, we took tap water and added acetaminophen to it. However, tap water does not have many dissolved electrolytes in it, so it's not ideal for electrochemical reactions. Therefore, we diluted this into our pH 9.5 Tris-HCl. So we did that, and the 10 part per million, which ended up right in the middle of our linear range at 5 parts per million after dilution, gave the best results, whereas the high and the low concentrations gave more bias and more variability. Next, we wanted to test pharmaceutical products. We purchased Tylenol tablets from the store. One of the tablets was weighed, ground up, the powder recovered was weighed, and then dissolved in distilled water. This was passed through a filter to remove some of the insoluble things from the tablet. And then this was diluted to an appropriate concentration in the buffer. 3 drops of this solution were analyzed for each tablet, and 3 tablets were analyzed for a total of 9 measurements. The overall results were accurate with a low bias around 1%. However, the results for each tablet were less accurate, and there was very high variability between the measurements. And we know that the tablets themselves were accurate and consistent, and so we suspect that a major source of this variability is that the tablets had a coating, and so when they were ground up, it was difficult to make them homogeneous. For our conclusions, we concluded acetaminophen is electroactive, both oxidized and reduced. So the detection of it is feasible, and our method should be further developed. And we can tie this in with a larger project we've been working on to detect other analytes with electrochemistry and expand the panel. However, some parts of the method should be further refined, and in particular, in addition to working on the electrochemical method itself, the process of actually recovering the acetaminophen from the tablet needs to be improved. What are some next steps we might want to take? For the electrochemical method itself, we want to explore cyclic voltammetry or cyclic square wave voltammetry for the calibration curves, since we did see that potential shift when we broke it into the 2 scans. We also want to look at other supporting electrolytes, so other buffers besides the Tris. We'd like to further explore the mechanism for ourselves, and we'd like to see if we can detect it in other matrices besides the tap water, and in particular look at biological fluids, since those are the type of samples that we would get from a patient. We'd like to do more replicates for the tap water and the tablets, and look at more different concentrations for the tap water. And finally, since electrochemistry is a screening method, it's not the end of the story, so it'll be important to look at complementary methods and especially confirmation, so we will look at developing a confirmatory method with LCMS. These are my references. I'd like to acknowledge the department, the funding I received through the Honors Excel program and the University Merit Scholarship. We'd like to thank Metrohm USA for their support, and I'd like to thank the rest of Dr. Oyo's research group. Please let me know if you have any questions and have a great day.